Good morning. This is David Henry. I'm the Communications Manager for the City of Amarillo. I want to welcome everyone to today's news conference for the latest in COVID-19 information for the community. Once again, we do these every Wednesday. Let me go ahead and introduce very quickly who is on our panel today. We are joined by Amarillo Mayor Ginger Nelson, Casey Stoughton, Public Health Director for the City of Amarillo, Dr. Scott Milton, Public Health Authority, Texas Tech University Health Sciences Center, Dr. Brian Weiss, Chief Medical Officer for Northwest Texas Hospital, Dr. Rodney Gonzalez, Director of the Amarillo VA, and City Manager Jared Miller. What we'll do is we'll turn it over to our panel for brief opening statements, and then we will take questions from our media. Let's go ahead and start with Amarillo Mayor Ginger Nelson. Mayor, how are you this morning?
I'm fine, Dave. Thank you. And how are you, Amarillo? I hope this finds you doing well as you're moving back toward normal. Despite our COVID experience, we are starting to see our city come back to more normal patterns. And one of those normal patterns is the start of school. Canyon started last week. Amarillo ISD will start next week. Bushland, River Road, Highland Park, y'all are all right in there. And I want to thank parents who are being flexible and helping their kids get back into the school routine with some new expectations, face masks and just changes in some of those, the way schools are meeting. But I want to thank all of you, schools, teachers, kids, for trying to get us back to where we need to be. And that is kids in school learning and families doing the normal routine that we've longed for the last few months. So we'll have cases coming out of school starting. We know that. The schools have done a lot of preparation. The public health department's been involved with that. So we'll be flexible and we'll be ready to adjust and make the changes that we need in order to keep schools open, keep kids learning, but most importantly, keep kids and teachers safe. So that's really all I have today, Dave. Thank you for setting this press conference up for us. I'll hand it back over to you.
Thank you, Mayor. At this time, let's now go to Casey Stoughton, Public Health Director for the City of Amarillo. Casey, how are you?
I'm good. Thank you, Dave. So just as a quick information on the numbers, as of yesterday, we had a total of 6,068 cases of COVID-19 reported in Potter and Randall counties, 3,966 in Potter County and 1,102 in Randall County. We have a total of 5,539 recoveries, and we do have an increase to 84 deaths reported in our community. We are, our heart goes out to each of the families who have lost a loved one. This leaves us with 445 active cases in our community. Each of the cases do represent a unique individual, and our staff take the time out to remove any duplicate tests so that we only count one test per person. The public health drive-through remains operational. You can call 378-6300 for a test. Our staff will screen and direct you to the test site. So far, we have tested over 7,000 individuals since we started testing on March 27th. And so that's just an amazing job. So we appreciate the staff there at the testing site. Public Health is participating in a clinical research study with Dr. Milton and Dr. Sigler at Texas Tech and PharmaTech's research. They're researching the anti-spike monoclonal antibodies. And so we're working with them to recruit research study candidates and are very excited to be part of the study. Like Mayor Nelson said, with the opening of schools, I do want to take a minute to recognize the hard work and planning that the administration, the teachers and parents have undergone with the start of school. Public Health has participated in those planning efforts, and we're glad to be part of a dynamic team. Keep our children safe and working to provide quality education. And that's all I have today, Dave. Thank you.
Thank you, Casey. And now at this time, we'll go to Dr. Scott Milton, Public Health Authority, Texas Tech University Health Sciences Center. Dr. Milton, how are you?
I'm good. How are you, Dave?
I'm good, thank you.
Good. So I'm pinch hitting for Dr. Lamentier this morning. So let me just kind of jump in and talk about BSA's numbers briefly. They have 23 patients in-house currently, which is holding steady and actually down a little bit if we compare that to 2 weeks ago or so. There are 3 patients under investigation. They're still waiting on testing. There are 12 in the ICU with COVID. I don't have the number that are on ventilators today, but yesterday there were 7 on the ventilator who were COVID positive. So that's the numbers at BSA today. Since there's been a big effort, as we've all been reading about in terms of vaccine development, I'd like to just go over with the public a little bit about about how these vaccines are developed and how we can bring them to market. So let me just spend a few minutes talking about that. For new vaccine development, there are essentially 3 phases, and we may have heard of this a little bit, but the first phase is called phase 1, where just small groups of individuals receive a trial vaccine, and they're tested for safety and really more for dosing. In phase 2, the study is expanded, where the vaccine is given to people who have characteristics maybe similar of the population that you'd want to give that vaccine for. And then once again, they are monitored for efficacy and safety. In phase 3, the vaccine is given to thousands of people. And I think some of the leading manufacturers are enrolling up to 30,000 people where they are volunteered to and given the vaccine. And once again, they monitor for efficacy and safety. As time goes on, I think what I'd like to do over the next coming weeks is maybe talk about some of the specific vaccines as they seem to be coming closer to market. And so I'll leave it at that. Dave, thank you.
Thank you, Dr. Milton. Now we'll go to Dr. Brian Weiss, Chief Medical Officer for Northwest Texas Hospital. Dr. Weiss, how are you today?
I'm doing well, Dave. Thank you. Hey, there's been a lot of news this week about the FDA approving convalescent serum. So let me just remind you about the theory of this. So if I get the virus, my immune system starts to make antibodies, which for lack of a better term are kind of attack proteins. The thought is, if you get the virus, can I help your system fight off that virus by giving you some of those antibodies or attack proteins that I've made by giving you an infusion of my serum? So that's what we've been trying to do to see if that would work. And so the first question, as Dr. Milton alluded with these tests are, is it safe? So they looked at a bunch of studies, and the answer is yes. It appears that over all these studies, that giving this convalescent serum is a safe measure. Now, the next question is it effective? And this is where the controversy is right now. So some studies have shown that there is a significant effect in people who are critically ill with COVID-19. Others have not shown such a clear effect. You say, well, what would cause that variability? Well, if you think about medications, every dose of medicine we give is exactly the same. Now, when you talk about convalescent serum, you're talking about different donors, and that's where the variability is. So some donors probably make more antibodies than others. Some may make more effective antibodies than others. So depending on the donor you receive the plasma from may change how effective it is in helping you fight that virus. Now Jerry, our lab director, made, I think, a very insightful comment, which is in the past when these kind of antibody therapies have worked, we've had to concentrate those antibodies instead of just giving plasma. So that may be the next logical step in trying to improve this therapy is to actually give concentrated antibody dosing. Right now at Northwest, we have really not done a lot of the convalescent serum in favor of the remdesivir, but obviously we will continue to look at this therapy as an option. Now, in terms of the numbers at Northwest, we have 21 positives in-house. We continue to show a slow, gradual decline in our number of positives. We have 6 in the intensive care unit and 4 on ventilators, which is great. That's a lot less we've seen in past weeks. Right now, we're using 12 of our 40 ventilators for patients in the hospital. In terms of testing, we actually have now a reasonable number of the rapid turnaround tests. Interesting, the CDC came out with new guidelines for testing within the last 24 to 48 hours. What they're saying is, if you have a high-risk exposure, namely you are within 6 feet of someone who's positive without a mask for at least 15 minutes, the CDC is saying they don't necessarily recommend you having to get tested. They do recommend at least 10 to 14 days of quarantine and monitoring for symptoms. Now, the interesting thing about this report is they put out some fascinating numbers. They said that if you have 10 people who are COVID positive, 4 of those people will not have any symptoms at all. So it's a 40% asymptomatic rate. The other thing they said is if you have 10 people who have spread the virus because they are positive, 5 of those people did it before they knew they were positive from symptoms. That's really significant because that tells us the importance of masks. That means almost 50% of people don't know they have the virus and can spread it before they have any clue that they're contaminated. So again, that's the importance of the spacing and the masks that the mayor's talked about and Dr. Milton has continued to reaffirm. With regard to remdesivir, we have enough right now to treat about 28 patients with a 5-day course each. Right now, we only have 2 patients who are receiving remdesivir, so we're in good shape with that. And then finally, you're going to see from us and from Texas Tech a big campaign on flu vaccinations. Please, you're hearing that from everybody is we are worried that the flu and COVID-19 is going to be a bad combination this fall. And the one thing we can control right now is getting flu vaccines. And hopefully, as Dr. Milton will go over the next couple of weeks, we hope to have a COVID-19 vaccine at some point. But please, that flu vaccine is critical to protect each of us from that possibly deadly combination. That's all I have for Dave. Thank you, Dave.
Thank you, Dr. Weiss. Now go Dr. Rodney Gonzalez, Director of the Amarillo VA. Dr. Gonzalez, how are you?
I'm doing well. Good morning and thank you. First of all, to go to our numbers, currently in patients, we have 6 COVID positive patients. We have 1 in the ICU, not on a ventilator, and then 5 on our medical surgical wards. And then we have 24 veterans that are on home self-quarantine that we are also tracking. We do have 1 PUI we're awaiting a result back that is not somebody admitted. One thing we're going to be doing here is next week, we are going to be increasing our number of available appointments for face-to-face throughout our specialties. And we still have the telehealth available, and we want to make sure that for veterans who feel they need to, would rather stay home, that we do have telehealth available if your provider and you feel that is the best way to receive your care. Tomorrow, we will be doing a telephone town hall with our veterans at 6 p.m. We've scheduled this. I've mentioned it before, and lo and behold, the military decided tomorrow's the day they're going to deliver my household goods that I've been living without for about 3 months now. So the telephone town hall will still go on. I just may not be able to make it depending on the delivery of my household goods and how that goes. And then finally, I'd like to thank our employees and what they are doing to take care of veterans each and every day, and especially through this pandemic. Appreciate all they are doing. I do want to underline what Dr. Weiss mentioned about the importance of the influenza vaccine. As we look to get our supply in the next couple of weeks, we encourage all of our community to get the influenza vaccine. But for us, we'll be reaching out to our veterans and staff to get them vaccinated as quickly as possible. And thank you once again, City of Amarillo, for this opportunity to talk to my fellow veterans.
Thank you, Dr. Gonzalez. Now go to City Manager Jared Miller. Mr. Miller, how are you today?
Always works better when you unmute. Doing good. Thank you, Dave. Just want to remind everyone that we are still operating under the Governor's Executive Order GA-28 and GA-29. GA-28 stipulates the limits for businesses. There are no occupancy limits. In other words, 100% capacity on essential critical infrastructure, religious services, local government operations, childcare services, youth camps, and recreational sports programs for youth and adults. There's 50% occupancy limits on outdoor events or establishments for professional, collegiate, or similar sporting events, amusement parks, swimming pools, water parks, museums and libraries, zoos, aquariums, natural caverns, similar facilities, and then also rodeo and equestrian events. And then every business establishment is operating at no more than 50% capacity on all the rest of the business categories, including restaurants. With regard to GA-29, GA-29 is the governor's executive order dealing with face coverings. We've had a number of people call the city asking if we would relax or eliminate the requirement for face coverings when out and about. This is a component of the governor's executive order GA-29, therefore the authority to waive the governor's requirements regarding face coverings. GA-29 is a standalone executive order of the governor relating to the use of face coverings during COVID-19. Per GA-29, every person shall wear a face covering over the nose and mouth when inside a commercial entity or other building or space open to the public, or when in an outdoor space wherever it's not feasible to maintain 6 feet of social distancing from another person not in the same household. There are a few exceptions, but a very lion's share of our population are required to wear a face covering per the governor's executive order at this time. And we don't have the ability at the municipal level or at the county level to discontinue that requirement. That's all I have, Dave. Is there any, and I'm ready to answer any questions.
Thank you, Jared. This time, we'll go to questions from our media. First off, let me go ahead. David Gay of Amarillo Globe News was not able to participate today. He did send questions in advance, so let me go ahead and Al will read questions. This would be for either Casey or Dr. Milton. After some school districts began the academic year last week, and some education institutions did as well, have there been any changes or updates in the guidance given to these institutions from the Public Health Department regarding COVID-19 prevention?
So, it's an ongoing partnership with the schools and with the colleges. We work together with them every day. We receive phone calls, we talk to them, but really the guidance has stayed the same. So 6 feet of distance, mask wearing, hand hygiene, students and staff, adults, not coming to work or school when they're sick. That basic guidance hasn't changed, but we do work very closely with them to make sure that those foundational guidances that they're able to operationalize that. And we definitely appreciate their partnership and their working together with us.
Thank you, Casey. This question would be for Dr. Weiss. I think during last week's news conference, you mentioned this, and David Gay of the Globe News is asking, is there any update on, I think was 11-day-old infant you spoke about last week who was diagnosed with COVID-19?
Yeah, so thank you. So it was an 11-day infant. It came from an outside facility. The baby did come with signs of being acutely ill, did test positive. I'm happy to say the baby did very well and is actually no longer in the hospital. So nice recovery.
Hey, fantastic news. Thank you, Dr. Weiss. This last question from David Gay would be for the panel as a whole. And I think you guys addressed this a little bit briefly earlier today. Have flu vaccines started to become available in the Amarillo community? And if so, what has the response been so far to people getting the flu vaccine? Has there been an increase in numbers compared to what we might see in a non-COVID year?
We have not received our flu vaccine here at the health department. I think that the very best thing to do would be to check with your primary care physician, watch the signs at the pharmacies. There's lots of different places where you can get your flu vaccine. Many employers offer flu vaccine. And so I think just, keeping an eye out for that flu vaccine and its availability is so important, and to be able to get, to be vaccinated as soon as you can. But definitely be on the lookout. Many times they'll have signs up, at CVS or Walgreens whenever their flu vaccine is available. So I think just keeping an eye out as you're driving around would be a great thing to do. And we'll certainly let our community know when the public health supply is available.
I will say, I'll just speak from a citizen's point of view that I went on Saturday to a local pharmacy and got a flu vaccine. So I do know they are in town. I have the bruise to prove it. And, but hopefully that means I won't have the flu to prove it.
Yeah, I say the same thing. We have not gotten our allocations at Northwest yet. We normally expect those typically around by the second week of September. But same thing, once we get them in all our clinics, we will be well known that they're available through Northwest.
Thank you, Dr. Weiss. Those are all the questions we had from the Globe News. Now we'll go to our media, let them ask questions. We'll start with Roger Gray of KVAI Channel 7. Roger, how are you today?
I'm good. Really just have one question. And I guess it's a two-parter, I guess. The TABC held an emergency meeting yesterday, and they ruled that bars can now use food prepared outside their premises as counting toward that 51% food service requirement to be considered a restaurant. I've seen this in other markets. What they generally do is work food truck. They'll park a food truck outside and then they can reopen. So a couple of questions, and it goes into effect immediately. It just came out today with the TABC. For doctors here, is this worrisome at all? And for the city, are there any other hoops they'll need to jump through to begin immediately working with a food truck?
From a municipal standpoint, from an operational standpoint, our health personnel will be working closely with TABC and any businesses in town that would like to take advantage of that. I don't know all the ins and outs on that, but I can guarantee you that our team does, and they'll be working productively with both the businesses and the TABC to make sure that whatever we're doing here in town is compliant and consistent with what the state is allowing.
I would comment, just generally speaking, that it's clear that it's much riskier that you could contract COVID in an enclosed space. And so if you have a food truck and people are eating outdoors, then the risk there is obviously much less.
But obviously the goal here is for the bar to be open. And according to the rule, they do not have to supply a floor plan of areas devoted primarily to food service or redo their menus to emphasize food over drinks. So I don't know how that'll work out in practice, I guess, but might they be eating and drinking inside the bar?
I don't know how that'll work out in practice either. I would just suggest that it's better to eat and drink outdoors.
Okay. And no other regulatory things they'd have to do as far as the city's concerned?
I'm not aware of it yet. I have not had an opportunity to review what you're referencing, but like I said, I know that our operational team and the environmental health department, which is responsible for managing those inspections, is going to be up to speed on it. So what I was saying earlier is that what we're going to make sure is that from a city's perspective, that the businesses that we're working with to facilitate their efforts to take advantage of that, that their efforts are being consistent with what the TABC and governor's intentions are.
Okay, thank you much.
Thanks, Roger. At this time, let's now go to Aaron Langston of KAMR Channel 4. Aaron.
Pretty good. How are you?
Good, thank you.
You was talking earlier about the convalescent theorem. How is that different from the plasma treatment that has been happening for a while now?
So you're probably talking about one and the same. Now let me put it this way: there's another process called plasmapheresis, where we literally, it's almost kind of a version of dialysis, where we would put a person's blood through essentially a filter in the effort to try to remove some of the things from the blood that might be making the person sick, like some of these cytokines you've heard in the past. So we have been doing some plasmapheresis on patients. The actual plasma infusion is the convalescent serum. So that's where it's coming from, a blood bank. It's given by people who have been positive for COVID and have tested positive now for antibodies. So those are two separate treatments, but basically that serum infusion is what we're talking about in terms of convalescent serum from donors who were positive.
All righty, thank you. And have there been any more staffing issues at any of the hospitals because of possible exposure or positive test?
I would say that right now we have 15 staff members who are quarantined because of either exposure or positive. We are still using nurses that came from the Regional Advisory Council, the RAC, and they've been doing a great job for us. So in that sense, that our staffing is stable, though we are having to rely on some outside resources to help us with that.
And I could just comment that per Dr. Lamentier's email to me that today they have a small number of nurses that are quarantined. So it doesn't sound like as much of a problem as in the past.
Alrighty. And is the VA still sending staff downstate to assist in places with much more cases than we have?
So for us, we do have, I know of one who's actually in Georgia right now, or at least was about to go. So, but I'm not aware of us having any currently down in the San Antonio area. That does not mean they're not down there. I believe we got our last one back from San Antonio this past week.
All righty. Thank you very much. I think that has me covered.
Thank you, Aaron. And now we'll go to Vanya Patino of News Channel 10, KFDA. How are you this morning?
Either Casey or Dr. Brian Wise. have we seen an increase in people going to get tested since school is starting back up?
Averaging at the drive-through testing site probably between 25 and 30 a day. And so we've been at that number since probably the second week of August.
Yeah, I would just say Northwest, we have not seen an increase. In fact, I'd say if anything, right now our positivity rate out of our testing is about 6.5%. And that's down from upwards of 12 to 13% more towards the beginning of July. So that's right now we have not seen any change yet.
Got it.
And I would just comment that I think Amarillo doesn't start back until next week.
That's true. Thank you. Yeah, that is true. Also, since the Texas State Department of Health Services said on Monday that it had technical issues processing test results, is that system backed up here also for the local cases in the city reports?
So we have been processing reports without any problem. We may a backlog of reports like we did a couple weeks ago through that NEDS-based system, but most of our local providers are reporting to us directly, and so we will see when we receive that that influx of reports through NEDS, but we don't have any indication that that will happen yet.
Okay, thank you. And also the CDC says it's not recommending testing people without symptoms, as you guys mentioned earlier. But when doing contact tracing, does the city test those who had contact even if they don't have symptoms?
So we generally recommend that a person wait until they become symptomatic to be tested, just so they don't have a false sense of security with that negative test. If you test too early, it may be that negative test may be because your body is still incubating the virus and you don't have enough of a viral load for that test to indicate that it's positive. And so the best thing to do is to just fulfill your quarantine time. If you become symptomatic, then we're happy to test. But it's just best to go ahead and just be quarantined so that you don't spread the illness like Dr. Weiss was talking about earlier. Some people are even asymptomatic, and so you just have to be quarantined. One of the things I'd like to highlight is that during contact tracing, it's so important that people talk to the staff at Public Health and that we're able to contact their contacts, those people who they've been around. That's one of the key factors in slowing the spread of COVID, is that Public Health is able to make contact with those people who have been exposed so that we can slow the spread through quarantine.
Okay, thank you. That was all my questions. Thank you so much for y'all's time.
Thank you, Vanya.
Thank you.
Well, that concludes today's news conference. I want to thank all of our panel members.